everybody, and welcome to Professor O, What Do You Know? Today we are going to be going over giving a subcutaneous injection. So one thing you need to know before you give a subcutaneous injection is actually where you're injecting the medication into. So subcutaneous injections are administered into the adipose layer right below the epidermis. You need to know that the area has very few blood vessels, so there's more of a slow, sustained rate of absorption into the capillaries. So for subcutaneous sites, you want to be able to choose where you want to give the injection. We can use the outer upper aspect of the arm. We can use the abdomen, the anterior aspects of the thighs or upper back, and the upper ventral or dorsal gluteal area. The absorption rates differ, so just know that if you're giving into the abdomen, it is the most rapid area for absorption. We need to make sure we choose the appropriate needle length and diameter, and we also need to make sure we understand what the angle of administration is going to be for our patient. So if we are going to be injecting at a 45-degree angle or a 90-degree angle. No more than 1 ml is given into a subcutaneous injection. And we also want to make sure that if a patient's getting a lot of subcutaneous injections, that we know to rotate those sites. We always inject slowly when we're giving medication at a rate of 10 seconds per ml. So once you have your medication that you know you're going to be injecting into your patient, you have your order, you've done all your safety checks, you're going to go ahead and draw up the medication. So today I have a medication called enoxaparin, 40 milligrams. It's a low molecular weight heparin. I'm going to go ahead and draw that up out of a vial. I am drawing 40 milligrams of medication up. This unit of measurement concentration is 40 milligrams per 0.4 mLs. So I'm using my tuberculin syringe, which is a less than 1 ml syringe, so I can draw up that 0.4 milliliters. I want to go ahead and clean the top of the vial with an alcohol prep. I want to grab my 1 ml syringe. I want to make sure I do not touch the tip of the syringe with my hand. We keep that tip sterile, and we connect that to the hub of the needle. I'm using a blunt needle just to draw up my medication and connecting the two aseptically. I want to go ahead and draw up the amount of air that I'll be injecting into, which is 0.4 mLs. I'm going to go ahead and hold the vial stable in my left hand, and with my dominant hand, I'm going to dart that needle into the vial, inject the air, and then bring that vial right up to eye level and withdraw my 0.4 mLs. I want to make sure I can see the needle inside the vial and inside the fluid, and I want to go ahead and make sure I get all the medication into my syringe. Sometimes you get a little air. That's okay. You can flick it a little bit to get the air out, and just keep working until you get the actual amount of medication that you need. Okay, so I have 0.4 mLs of medication here, and one more air bubble I want to get out of there. Okay, good. And then I want to go ahead and change the blunt needle out, and I want to go ahead and put that in the sharp spin, and I want to put my subcutaneous needle on. I know this is a subcutaneous needle because it is a 25 gauge 5/8 of an inch needle. That is a higher gauge needle, which means it's a smaller diameter, and a short needle at 5/8 of an inch. I want to now go ahead and connect my needle syringe to my syringe, excuse me, and I want to go ahead and prepare the patient's site. So now I'm going to go and hand hygiene, and I'm going to put my gloves on, and then we'll get ready to give the injection. Now, I'm going to show you both angles. We can do 45 or 90 again, depending on the patient's subcutaneous fat. I'm using the injector pad here just to demonstrate for you guys. So firstly, I want to do is prepare the site. I want to take my alcohol prep. I want to start at the center of where I'm going to inject. I want to rub vigorously in an outward motion away from the injection site with the alcohol swab. Then I want to go ahead and grab my needle. I want to take the cap off with my non-dominant hand. I want to turn the syringe upside down and hold it like a dart. If I am doing a 45-degree angle, I will maybe need to pinch the skin and go in at that 45-degree angle like so. Otherwise, I can go in and inject at a 90-degree angle. So right now I'm going to go right into a 90-degree angle. I'm going to dart the syringe right in. I'm going to go ahead and inject the medication slowly at a rate of 10 seconds per ml. Once the medication is in, I'm going to go ahead and pull the syringe right out, and immediately I'm going to engage my safety. Once the safety is engaged, I'm going to put the syringe and needle into the sharps bin. If I happen to see any oozing at the site, whether it's some of the medication that I injected or any bleeding, I would take a 2x2 and just gently put some gentle pressure on the area, and I would not be rubbing the area vigorously or anything like that, just some light gentle pressure. And then I want to go ahead and clean up my area, take my gloves off, hand hygiene, document the injection that I gave, and of course come back and reevaluate the patient after the medication and reevaluate the site for any changes. And that's it. That's injecting a subcutaneous injection. And please subscribe and suggest anything that you would like to see in the future, and share this video.